Welcome. COVID-19 pandemic has led to loss of human life worldwide and has caused an unprecedented challenge to public health, food systems, and work. The economic and social disruption caused by this pandemic is devastating. This session will focus on COVID-19 nutritional care. In December 2019, there was an outbreak of pneumonia of unknown cause in Wuhan, Hubei province in China, which affected more than 60 people. On December 31st, the Wuhan Municipal Health Committee informed the World Health Organization that 27 people had been diagnosed with pneumonia of some unknown cause, of whom 7 were critically ill. By January, the first case of coronavirus disease, COVID-19, had been reported outside China, 2 in Thailand and 1 in Japan. This infectious disease that originated in China spread to other parts of the world, leading to the outbreak of a pandemic. WHO declared it as a health emergency of international concern, and by that date, the disease had been detected in all provinces of China, and cases were also diagnosed in 15 other countries. In March, the disease was recognized as a pandemic by WHO. The number of confirmed cases continued to grow, causing concern among the population. Historical reports show that this virus was reported in different parts of the world like the Spain, Italy, France, Brazil and the US before it was reported in China. The virus that produced COVID-19 is the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, that mainly affects the respiratory system and spread by droplet infection that is generated by an infected subject. SARS-CoV-2 binds the angiotensin converting enzyme 2, which is called as the ACE2 receptor in the alveolar epithelial cells. The immune system responds through inflammation-related manifestation and through the action of antigen-presenting cells. In this image, we can see the SARS-CoV-2 virus binding to the angiotensin converting enzyme 2. The disease can be asymptomatic or present with mild infection of the upper respiratory tract, while in the most severe cases, it is characterized by acute respiratory distress syndrome, heart failure, septic shock, multiple organ failure, and pulmonary tissue damage. Symptoms of COVID-19 could be of 3 types: the common symptoms, less common symptoms, and serious symptoms. Under the common symptoms, we have fever, dry cough, and tiredness. Among the less common symptoms are aches and pain, particularly body pain, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, skin rashes, or discoloration of fingers or toes. The serious symptoms include difficulty in breathing or shortness of breath, chest pain, and loss of speech or movement. This image shows the various symptoms of COVID-19. So the patients suffering from COVID-19 exhibited various symptoms including fever, chills, cough, shortness of breath or difficulty in breathing, fatigue, muscle or body ache, headache, loss of taste and smell, sore throat, congestion or runny nose, nausea and vomiting, and also diarrhea. There was a peculiar symptom encountered by the patients suffering from COVID-19, which was anosmia and dysgeusia. Anosmia means loss of smell sensation and dysgeusia means loss of the taste sensation. Presence of other chronic diseases in the patient may exacerbate the inflammatory response derived from COVID-19, increasing the risk of mortality. The systemic inflammation present in subjects with non-communicable diseases such as diabetes tend to make the respiratory symptom of the infection more severe. This disease infected the vital organs of the body, including the lungs, heart, pancreas, intestines, kidney, liver, and also the brain. 88.7% of the patients suffered from fever. 57.6% had cough. 45.6% had dyspnea. 33.9% had anosmia. 29.4% presented with myalgia. 28.5% produced sputum. 11% had sore throat. 8% suffered from headache. And 6.1% had diarrhea. The complications of COVID-19 infection included acute respiratory disorder in 32.8% of the patients, thromboembolic events in 20%, 13% had acute cardiac injury, 7.9% had acute kidney injury, 6.2% presented with shock, and 5.6% had secondary infections. Hospitalization was inevitable for the COVID-19 patients in the preliminary stages, and particularly for those patients who had other complications such as hypertension, obesity, chronic lung diseases, diabetes mellitus, and cardiovascular diseases. The question now is how to reduce the impact. A well-balanced diet can assist people who are infected or who are recovering post-COVID-19 infection. It is very crucial to meet the increased nutritional requirements of the body as it helps in replenishing the physical, mental, and emotional well-being during this time. Few modifications in the daily routine will help in early and healthy recovery. A balanced diet and a healthy living is very important to prevent infection and also to speed up the recovery process. The image which we see here is called as the food pyramid. The food pyramid shows us the way to eat healthy. At the bottom of the pyramid, we find the cereal and the cereal products which we should eat adequately. Above this are the fruits and the vegetables that can be eaten liberally as much as you want. Above that, we have the protein-rich foods like the pulses, nuts, and also the dairy products and the animal foods like meat, egg, and poultry. So this has to be eaten moderately. At the top of the pyramid are the foods that has to be eaten sparingly, and it includes the sugars and the fatty foods. The macronutrients such as the carbohydrates, proteins, and fat play a vital role in the treatment of COVID-19. COVID-19 infection is characterized by fever, and during fever, the BMR increases, basal metabolic rate increases. For every 1 degree increase in the body temperature, the BMR increases by 13%, and therefore the energy requirement during this infectious condition also increases. While fighting the virus present inside the body, a lot of energy is used that makes the patient feel drained and tired. Adding calorie-dense foods to the diet is necessary at this time to energize the patient. Fuel yourself with nutrient-dense foods. These are some of the energy-giving foods. Carbohydrates, the cereals and cereal products, roots and tubers, fats and nuts, and also the sugar and sugar products. Include adequate amount of these foods in the diet of a person suffering from COVID-19 in order to provide energy which is sufficient to meet his or her requirements. Protein is an important nutrient for cell growth and regeneration. It is called as the body building food. It is the building block of life and is required by our body for faster recovery. When suffering from COVID-19, it is recommended to eat a high protein diet. Taking 75 to 100 grams of protein is essential. Add more of foods like pulses and legumes, milk and milk products, soybeans, nuts and oil seeds, meat, chicken, fish and eggs in the diet. And why do we need protein? Protein is required to build up our immune system. The immune system is a wonderful collaboration between cells and proteins that work together to provide defense against infection. The immune system is dispersed throughout the body to provide rapid response to infection. Cells travel through the bloodstream or in specialized vessels called lymphatics. Lymph nodes and the spleen provide structures that facilitate cell-to-cell communication. Protein deficiency is linked to impaired immune system function, mainly due to the negative effect on both the amount of functional immunoglobulins and gut-associated lymphoid tissue. Besides quantity, the quality of protein is also a very important factor with respect to the relationship of this macronutrient with the immune system. It has been highlighted that including proteins of high biological value containing all the essential amino acids may exert an anti-inflammatory effect. In addition, some amino acids such as arginine and glutamine are well known for their ability to modulate the immune system. Food sources of protein includes the vegetable sources such as the pulses and legumes and the nuts and oil seeds. The animal sources include the dairy products and also the animal products such as the egg, fish, meat and poultry. Fat is essential for the daily body processes and also for the absorption of the fat-soluble vitamins and should be prescribed in optimal balance. Fat should comprise of not more than 20 to 30% of the total caloric requirement of an individual, and the ratio of the different type of fats that should be present in the diet should be 1:1.5:1 of the saturated fat, monounsaturated fatty acids and the polyunsaturated fatty acids. Sources of fat includes the saturated fat source from the animal products and dairy. The monounsaturated fats present in olives, soybean, groundnut, almonds, rice bran. Omega-3 rich sources include the flax seeds, sesame seeds and pumpkin seeds, which contains alpha-linolenic acid, and eicosapentaenoic acid and docosahexaenoic acid present in fatty fishes such as salmon, tuna, mackerel and sardines. And avoid the trans fats that are present in the baked foods. Omega-3 fatty acids, eicosapentaenoic acid and docosahexaenoic acid can inactivate the envelope of the virus. EPA and DHA inhibit cyclooxygenase enzyme that may suppress prostaglandin production. They are required for the formation of prolactins, resolvins and marzins. Supplementation with DHA and EPA may be useful to reduce the severity and improve the recovery of patients with COVID-19. Phospholipids, glycolipids or sphingolipids have the ability to block the platelet activating factor and its receptor, exerting anti-inflammatory effects that may be beneficial in COVID-19. Carbohydrates are the major source of energy. Carbohydrates and dietary fiber have been reported to be related to the immune system function. Consumption of those with high glycemic index as found in the processed foods can lead to mitochondrial overload and subsequent free radical synthesis. increased circulating levels of inflammatory cytokines such as the C-reactive proteins, tumor necrosis factor alpha, and interleukin-6 have been reported with the consumption of such processed foods. Therefore, choose foods that belong to low and moderate glycemic index. Reduce the intake of simple sugars such as the monosaccharides and the disaccharides. Fiber. Several studies have revealed that an adequate fiber intake to an amount of 25 to 35 grams per day may help to reduce both systemic and gut inflammation. Consumption of foods that are a source of fiber has been related to lower levels of inflammatory cytokines such as the C-reactive protein, tuber necrosis factor alpha, and the interleukin-6, as well as enhanced levels of the short-chain fatty acids. Different short-chain fatty acids such as the acetate, propionate, and butyrate have a direct anti-inflammatory effect by inhibiting the release of pro-inflammatory molecules. How to choose your carbs? Complex carbohydrates usually comprise of whole cereals, starchy vegetables, and whole grains. Carbohydrates are also present in fresh fruits and vegetables. It's recommended to include food items such as the whole grains, wheat flour, corn, red or brown rice, jowar, bajra, ragi, fresh fruits, and vegetables. Refined carbohydrates should be restricted in the diet. These occur in corn flour, refined wheat flour, and products made of the same. Refined sugar and products should also be restricted. In addition, simple sugars also are presented in the aerated drinks, sweetened beverages, and carbonated drinks, which should be avoided. These are the food sources of fiber: whole grains and legumes, green leafy vegetables, vegetables and fruits. So these foods can be included as much as possible in the diet of a patient suffering or convalescing from COVID-19. Short-chain fatty acids play an important role in the maintenance of an adequate gut microbiota by increasing the diversity and enhancing the presence of specific health-associated bacteria. Besides gut microbiota, nasopharyngeal microbiota may also be involved in the respiratory infections. Taking into account that COVID-19 has been related to respiratory and gastrointestinal symptoms, it seems plausible that gut microbiota impairment may occur, which in turn can result in an enhanced inflammatory status. In this image, we can see that the dietary fiber, when acted upon by the gut microbiota, produces the short-chain fatty acids that are very important in the synthesis of various immune bodies. In part 1, we saw how this pandemic emerged and toppled the entire world. The effect, nature, and symptoms of SARS-CoV-2, the nutritional implications pertaining to the consumption of a balanced diet, and the role of macronutrients. Let us catch up in part 2 of the video for further details. Thank you.